Hi, my name is Tanya, and this is my answer to the RA Fit Kit joke. I've got a big bullseye on my face now because I'm not pretty, I'm not sexy, and I can't move the way I'm supposed to move. I am a real RA patient. I am a registered nurse. I'm not a fitness expert. But this is what I do. This is the way I have found to keep moving. This is part 1, upper body stretching. I want to go over a few key points. One of them is this is not to be painful. What we are looking for is a gentle pull, a stretch, not pain. If there's pain, you stop. That means if a joint is flaring, you don't use it. You can move on to a different exercise. If at any point during an exercise you develop pain, stop. So we're going to start with the neck, and we're just going to tilt our head back. Nice and slow, no jerky motions. The idea is to point your chin at the ceiling. Mine don't get there. And you want to, once you reach the point of stretch, but not pain, hold it for the count of 5, and then bring it back to a neutral, which is facing straight on, chin level. Then you're going to take your choice, and you're going to try and touch your ear to your shoulder. Don't hunch, and again, pull, not stretch, not pain. Hold once you get it there to the count of 5, and then bring it back to neutral. And then do the other side. Don't hunch the shoulders. And then back to neutral. And then chin to chest, not up here. You're wanting to go down here, but don't bend your back. That makes your head come down so that you're actually moving at the base of your neck. Hold to the count of 5 and then come back up. Next, we're going to move on to shoulders. They're very simple, very easy. Start with a shrug, hold to the count of 5 and down. Each of these you want to repeat like 5 times before you move on. Like the neck, do all of it, and then all of it, and then move on to your shoulders. So you want to do those 5 times. Then we're just going to roll forward and roll back on both sides. You can do them together. You can do them one at a time. I find it depends on how my back feels, because you will get some motion in the back. Then we want to raise your arm straight out, level from the shoulder, arm completely straight. Obviously my arm's not straight, but the goal is straight. Hold to the count of 5 and bring it back down. Both sides, 5 times each, hold to the count of 5. Now we want to go out to the side. Again, level from the shoulder, arm straight, hold to the count of 5 and down. Now this shoulder, don't do it. This is as good as I get. Okay. We have a lot of trouble with carpal tunnel also. So there's a little variance on this that can kind of help with that. It's going to stretch all down the arm and hopefully try and open some of those up, those passageways up. And it's a combination of the neck and the arm exercises. So you want to put your arm out. I'll do it this side because this one works better. Tilt your head the opposite way and flex your hand like this. So you're going to be pushing through the wrist. Now, my wrists don't go very far, but just as best you can. And you should feel a pull all the way down your neck, all the way out your arm. Again, pull, not pain. Okay? You're going to hold that to the count of 5. Then you're going to switch, and you're going to put your head the other way and drop your wrist down. And again, you're going to be pushing through. It'll feel like you're pushing through your wrist. So you're kind of like this. Sorry, my camera's not that great. You do both sides, counts of 5, 5 repetitions. Before I knew I had RA, I had a physical therapist show me those, and it actually did help some with my hands, even though I didn't actually have true carpal tunnel. Elbows. Sounds simple. You're going to start with your arm straight. I know, mine's not. As straight as you can get it, palm facing the ground. Move your elbow in and out. Then we're going to rotate it halfway up and in and out. Then you want to turn it so it faces the ceiling. Obviously mine doesn't. And in and out. 5 repetitions each. Both sides. Nice and slow. No jerking. No pain. Pulling is fine. Pain is not. Now when you do this one, if you can actually get your hand up, your elbow is going to come down some. Hands are the wrists. I'm forgetting joints. Wrists, you want to turn them in. Let's see if I can get, I guess we'll do it this way. Lean it sideways, up, and then push it out towards the thumb. Can't do it sitting up like that. And then of course just nice easy circles, both directions. Okay. Hands, fingers, hands. The bane of a lot of our existence. Simplest ones first. Try and make a fist. Obviously mine don't get there. And then stretch them out as far as they'll go. 5 times each. Then you want to curl just the top, it's actually the middle joints, down. If any of you know sign language, what you're trying to do is the letter E. Your fingertips should touch the ball of your hand here. Mine don't. Okay, then you're going to move the big joints here and almost like you're waving, but nice and slow. And when you feel the pull, stop. You want to count that pull, not pain. This one's a little harder. You're going to take your thumb and you're going to touch it to each of your fingertips is the goal. I can't all of them. But hold to the pull and then touch, touch, touch. Then go backwards. Touch, 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 pull. You're going to do both hands. Okay, now we're going to do the back. You want to drop one arm off the side of the chair so that it dangles. You want to lean into that side, keeping your butt firmly planted on the chair until you feel the stretch up the side. If you need a little higher level, take the opposite arm and reach over your head so that your arm goes, up by your ear. Hold to the count of 5 and come back up. You're going to do that to both sides. 5 repetitions each. Now we want to kind of do a little twist. Again, I drop my arm over the side of the chair and I take my opposite hand and I reach towards my shoulder, gently turning my body so that I get the pull, not the pain. Now if you want to step it up a level and you have the mobility, you can actually take your arm over the back of the chair and do the twist. You're going to do both sides. Hold to the count of 5 each and 5 times each. Well, you did it. You made it through the upper body stretching. I hope you had a good time. I hope it has helped you. Remember, there are different levels. Only do what you can do. But if you can do these every day, it gives us a chance to keep some of our mobility back.